Assalamualaikum warahmatullahi wabarakatuh. My name is Nazatul Syazwina Binti Nazri, and I will present my case study presentations, anemia management in pregnant women and undernutrition in children under 5 years old. I have been placements at Klinik Kesihatan Bandar Mentakap. So the first cases is anemia management in pregnant women. So this is the table of content. So introduction of the patients is patient I. She is 38 years old, female, Malay. She lives at Kampung Paya Pulai. She is currently in the 4th pregnancy and she is week 25. She lives with her husband and 3 children and she works in the office. She has a diploma and sedentary lifestyle and she has a history of hemorrhage during her last pregnancy and no history of anemia. Her case chronology is that she refers to a nutritionist on 25th week of her gestational age, where her HB level is 10.6 GDL, and her diet recall is 172.5, and her weight during the visit is 67 kg, and her BMI is 26.3, which is overweight. So during the counseling, we're advised to consume food with high content of iron, separate the time intake of milk with medication Z-copper to avoid iron malabsorptions, and conduct light exercise for 1 hour only every day. So for her next follow-up is that to monitor her HB level that increased to 10 and change the intake of medication timing. Her medical diagnosis is anemia or iron deficiency anemia, which is a type of that doesn't have enough iron to produce sufficient amount of hemoglobin, and the most common anemia during pregnancy and postpartum periods. She diagnosis with hemoglobin concentration not lower than 10 GDL. Her symptoms are breathing difficulties, fainting, tiredness, difficulties. Complications to the perinatals is infant growth retardations, prematurities, low birth weight. And the risk factor is mother who have multiple birth, 2 pregnancies that goes together, pregnant teenagers, lack of diet that rich with iron, and anemia histories. So her diet diagnosis relation is that anemia problem experienced by patient I is due to lower consumptions of food rich in iron source, taking medication of hemetic pills together with milk, and history of hemorrhage during delivery. Her medications and drugs are zinc-copper, which is 1 dose a day, which is a supplement that helps to prevent fetal abnormalities caused by zinc deficiency during pregnancies. And it absorbs in duodenum and jejunum with absorption enhanced by stomach acid secretions. Side effect may be extra-intestinal discomfort, anorexia, nausea, vomiting, constipation, and diarrhea. Move on to the nutritional assessment and intervention. First, nutrition assessment, anthropometer. As you can see, the increase of weight and increase of BMI. Second is biochemical data. As can see, her blood pressure and GT test both show at normal range, but the patients have normal HB level at the first trimester before it slowly dropped to 10.6 GDL as she's entered second trimester. So below our dietary assessment, which overall she's total is 1,704. Comment on dietary assessment that her total dietary intake is 1,704. She's currently fasting and started to consume milk daily in diet, which she takes during sahur together with her medications. She had no specific food habit or allergic reaction to any food, and no problem with the source availability, and no dietary related symptoms such as vomiting, diarrhea, and constipation. So her nutrition diagnosis is a sufficient hemoglobin concentration related to imbalanced food and nutrition knowledge deficits on nutritional iron intake, psychological blood loss during previous delivery as evidenced by low concentration of hemoglobin by 10% GDL with normal serum ferritin levels. So for the objective, short term is to increase the intake balanced diet in food with higher iron and protein. Long term is set to achieve an ideal normal hemoglobin concentration more than 11 GDL before 36 weeks, averaging a balanced diet through pregnancies. So the suggestion is recommended Bina Sehat to encourage consumptions of food that high in iron in every meals and meal intake 2 times per day, separate consumptions of iron medication with milk product, and continue to take hemostatic pills with beverage high in vitamin C for promoting iron absorptions. So below is the estimate energy requirement, calculation of BMI and IBW, calculation using equations and quick method, which is Harrison Benedict formulas. So her energy range is between 1,685 to 1,693. So the recommended calorie intake is 1,690 kilocalories per day. From below, estimate micronutrient distribution and requirements. So as you can see, carbohydrate is exchanged to 12, protein exchanged to 3, and fat exchanged to 7. So below is distributions of exchange portions to food group tables. So total recommended is 1,690 kilocalories per day. So below are the planned suggestion menu for weekday 1. So total kilocalories is 1,664. So below are the suggestions for weekday 2. The total kilocalories is 1,684 kilocalories per day. So lastly is for the weekends. So the total kilocalories is 1,688.7 kilocalories per day. Move on to nutritional monitoring and evaluations. From the data, we can see that per pregnancy, first consultations and follow-up, there is increase in HP level, which is from 10.6 GDL to 10.8 GDL. She had adjusted meat intake during birth to avoid iron malabsorption from her zinc food intake and consumed lemon or lime juice to promote iron absorption during sahur. She also consumed more protein intake with higher iron level during sahur and iftar. So now move on to discussions. Anemia is one of the common complications during pregnancies that can adverse pregnancy outcome and affect all ages. So patient I was diagnosed with milk anemia with hemoglobin level 10.6 GL, and is suspected to anemia due to low intake of rich in iron, taking hemolytic pills together with milk causing iron meal absorption and history of hemorrhage during delivers. So it's also because suggestion that related psychological change during pregnancy, which is due to plasma dilutions. So the recommendation for patients I during nutrition counseling session is consume food with high irons contained during sahur and iftar, for example like fish. She should vary her source of protein intake and not only focus on animal source only, choose vegetables and fruits that also rich with irons. Separate the time consuming hemolytic pills with milk product to avoid process of iron malabsorption during sahur, and consume hemolytic pills with beverage high with vitamin C such as lemon or lime juice to increase iron absorption. Practice pinggan sehat, quarter carbohydrate, quarter protein, and half vegetables and fruits. So as a conclusion, patient was diagnosed with milk anemia and overweight. Her past history is hemorrhage during the liver and stress from the pregnancy can also lead to sudden drop of HP level for second trimester. So the patient is advised to change her intake time of medication and consumption of milk together with food products, hemp and non-hemp that high with iron level in her diets. The patient is also advised to take the medications together with beverage with high vitamin C during sahur to promote iron absorption. Now, move on to the next case, undernutrition in children under 5 years old. Below are the table of content. First is introductions of the patient, name H, 2 years or 4 months old, females, Malay, live at Kampung Payu Pulai, the first child. She lives with both her working parents and a grandmother. She has not received education yet, and she has a sedentary lifestyle. No history of low birth weight or close relative with stunted histories or wasting. For the case chronology, the patient referred to a nutritionist for weight gain diet and nutritional counseling education for the mothers. 24-hour diet course was taken, which is 861 kilocalories. The current weight is 8.4, which is underweight, and current BMI is 12.4, which is wasted. For the nutrition counseling was done, with the advice to nutrition varied the source of food that high in carbohydrate and protein according to recommendation energy intake for age. Introducing slowly to fruits and vegetables in diet intake, and increase the frequency of formula mix as a source of protein. For the next follow-ups to monitor her weight gain, ideal weight BMI is 14 to 15 kg and target body weight is 9 kg and expected the ideal weight gain is 0.6 kg per month. For the medical diagnosis is underweight and wasting, a health concern that occurs when the children's weight is not sufficient with the current height when referring to the WHO growth chart and eventually lead to stunt wasting growth as she remains at the yellow line. So diagnosis is underweight is below negative 2 SD until negative 3 SD and wasting, which also below the negative 2 SD until negative 3 SD. But the symptoms are fatigue, paleness, and loose fall of skin on the arms and thighs. Respective of the underweight children is malnutrition, vitamin deficiency, decreasing in immune function, and delayed growth and development. The causes is usually inadequate exclusive breastfeeding, discourage complementary diets, lack of nutrition knowledge, inadequate nutrition absorption, or increased energy requirement. Diet diagnosis relation is undernutrition problem faced by patients has is due to inadequate calorie intake, which is only 863 kcal per day. Picky eaters and lack source of nutrients and minerals for growth and development. Move on to nutritional assessment and interventions. First is anthropometer. Current weight is 8.4 kg is underweight and body mass index is 12.4 kg meters to is wasted. Next slide is the graph for BMI for age. Next is dietary assessment with total is 861 kcal per day. Comment on dietary assessment is her total dietary intake is 861 kcal per day. She's a picky eater and refused to consume rice, chicken, fish, and egg in her food intake. She mostly consumes her source energy from bread, biscuits, and milk product only, where she consumes milk 4 times a day and doesn't consume any processed food and doesn't want to take fruits and vegetables in her diet. She often vomits or spit out the food she dislikes and refuses to try new foods. For nutritional diagnosis, is inadequate carbohydrate and protein intake related to food and nutrition knowledge deficiency on variety food source as evidenced by diagnosis to be underweight and wasted as her body mass index is 12.4 kg meters, which under 3rd percentile based on WHO growth chart. So the short-term objective is to increase the patient intake carbohydrate and protein consumption in daily basis to catch up the children growth. For the long term is to achieve the ideal weight, body mass index, and gain 0.9 kg per month for her age. So the menu planning suggestion is to ensure the adequate daily energy intake according to recommendation of her age. To ensure adequate intake and varied carbohydrates and protein source. Encourage intake of fruits once a day in meal and ensure slowly reduce intake of formula meat in daily diet and to introduce a complementary food in daily diets. So below are the estimate energy requirement which is calculation of BMI. Calculation using equation of RNI for 2 years old female is 900 kcal per day. So the energy range is between 900 to 1000 kcal per day. So recommended calorie intake is 990 kcal per day. So below are the estimate macronutrient and distribution and requirements, which is a carbohydrate exchange to 5, protein exchange to 2, and fat exchange to 3. Below is distribution of exchange portions to food group table, where the recommendation is 990 kcal per day. For the plan suggestion menu for weekday ones, so overall total kilocal is 962.5. So below are the plan suggestion menu for weekday 2, where total kilocal is 962 kilocal. So next is the plan suggestion menu for weekend, which total kilocal is 999.2 kilocal per day. For nutrition monitoring and evaluations, so from the table from the first consultations until the follow-up, the children are slowly increasing in her weight and also BMI, but its still indicator is underweight and wasting. So to ensure the compliant weight, height, and BMI will be monitored during monthly visit to the clinic. Her mother also needs to claim that she adjusts her daughter food source of carbohydrate and protein intake, and also slowly start to feed her daughter fruits in her daily diet. Move on to discussions. Nutrition is insufficient intake of energy and nutrients to meet individual needs to maintain good health. Patient has were diagnosed with underweight and wasting based on her WHO growth chart that remains in yellow line because she is not exclusive breastfeeding for 6 months due to her mother working style, when the breast milk is the essential source of nutrition that provides infants with immunological protections and free from contamination. She also a picky eater which eat a limited amount of food and unwillingly to try new foods leading to unbalanced diets. So the recommendation for patients are during counseling is to introduce varied food with high source of carbohydrate and protein to ensure adequate energy intake based on her requirement for age. Slowly introduce and encourage intake of fruit once a day in the meal because of its perfect balance of nutrition and sweets to growth. Advise to slowly reduce intake of formula milk in daily diet and replace with complementary food after 3 years old. Caregiver is also advised to encourage the patient H to not practice spit or vomit out to any disliked food. So, as a conclusion, patient H was diagnosed with underweight and wasting. Because she's a picky eater, so modification of her diet is introduced to the varieties of food from bread starch with high carbohydrates and protein to improve her growth and development. Patient is also slowly exposed to fruits as a perfect blend of nutrition and sweet diet that can slowly improve the child growth and is provide necessity nutrients and minerals for her. The caregiver will also advise to monitor closely every month of her weight to ensure the compliance. So next slide are the reference. That's all for me. Thank you.